speaker is Professor GAO Jianbo, the Vice President of the First Affiliated Hospital of Zhengzhou University, the Vice President of CSIT and President of CT Procession Committee of CSIT. And another speaker is Dr. Liang Pan from the First Affiliated Hospital of the Zhengzhou University, the Secretary of CT Image Technology Committee of CSIT. The topic is Prevention and Control Measures in Radiology Department for COVID-19.
Distinguished ladies and gentlemen, firstly, it's my great honor to be here to join this forum. My name is GAO Jianbo from the First Affiliated Hospital of Zhengzhou University. The topic of my presentation is Prevention and Control Measures in Radiology Departments for COVID-19. Since December 2019, a number of patients with COVID-19 have been reported in the world. On February 11, 2020, diagnosis and treatment protocols of COVID-19 infection was published by NHC of China. It indicated that X-ray and CT examinations were effective methods for the screening and diagnosis. However, most radiologists and radiological technologists in radiology departments had less experience when facing the patients. In order to reduce the infection risk, the topic of my presentation aimed to guide the prevention and practical work in the radiology department. As shown in the picture, I will introduce my topic briefly the following aspects. The first part, personal protection levels. Personal protection levels include 4 parts: general protection, primary level of protection, secondary level of protection, and the third level of protection. Among them, general protection should include wearing work clothes, disposable medical masks, work caps, and gloves if necessary. Primary level of protection. It is suitable for pre-examination and triage, fever clinic, and infectious disease clinic. Wearing disposable work caps, disposable medical masks, work clothes, isolation gowns, and disposable latex gloves, and strictly implementing hand hygiene. Secondary level of protection. It is suitable for medical staff who has close contact with suspected or confirmed patients. Wearing disposable work caps, protective goggles and face shields, medical protective masks, protective clothing or isolation gowns, disposable latex gloves, and disposable shoes covers, and strictly implementing hand hygiene. Third level of protecting. It is suitable for aerosol generating procedures performed for suspected or confirmed patients. Wearing disposable work caps, medical protective masks, protective face shields, medical protective clothing, disposable latex gloves, and disposable shoe covers, and strictly implementing hand hygiene. The second part, requirements for working environment and positions. Requirements for working environment. An independent medical imaging examination room is needed, and different working areas should be strictly separated. To prevent cross-infection, an independent medical imaging examination areas or a dedicated radiological examination requirements as well as a dedicated film printer should be available. The plotted areas, semi-plotted areas, and cleaning areas would be strictly separated and disinfected. If examination room cannot be separated, strictly equipment and air disinfection are required after the current patient scan and between patient encounters. The key areas must be disinfected after the examinations for confirmed patients and before the examination for next suspected patients. The examinations routes must be established, based and time-separated services should be carried out with a strict disinfection. Requirements for medical staff in radiology department. At least one administrator needs to be designated, who is responsible for direction and supervising. They must guide the whole disinfection, make a clear division, and report in time. Radiographers for beside X-ray photography, specific radiologists need to be arranged to carry out beside X-ray photography in key areas and take standardized photography. They are required to take the secondary level of protection. In the case of work, they may cause burning or splashing of respiratory secretions and substances of the body. The third level of protection is required. After each examination, the surface of equipment should be disinfected. Radiographers for DR and CT examinations. The radiographers in charge of patient position should strictly implement the secondary level of protection. The radiographers in charge of operation equipment can take the first or secondary level of protection. Staff for patient registration in the key areas. Patient registration should be completed by the radiographers, and any materials with the confirmed patients must be separately and safely stored. Staff for patient registration in the non-key areas should take the primary level of presentation. We should make full use of the hospital HACE PACS race to achieve paperless management. The staff working in the non-key areas in the radiology department take the general protection when working in the cleaning areas. Take the primary protection when working in the semi-contaminated areas, and take the secondary protection when working in the contaminated areas. In the case of work that may cause spraying or splash of respiratory secretion and substances of the body, the third level of protection is required. Working mode for radiographers in key areas. Trial. The radiographers for besides X-ray photography, DR and CT examinations working in the isolation area should take a 2+2 working mode. In the 2+2 working mode, the radiographers should complete a first period of 14 working days in the isolation areas, and take a second period of 14 days in a dedicated isolation ward for supervised medical observation before returning to normal work. The third part, processes of wearing and removing protective chlorine. We should take the 7 steps of hand washing process of wearing protective clothing as follows. Process of removing protective clothing in contaminated areas and the semi-contaminated areas. We should take the steps of process of removing protective clothing as follows. The first part, cleaning and disinfection of radiology equipment. Daily cleaning. According to the specific radiology equipment, we should use different methods of disinfection. One thing to know that metal surface and painted surface can be wiped with soft detergent and dried with dry towel. Plastic surfaces can only be cleaned with soap and water. Be sure to remove the liquid drops in time. Equipment disinfection. After each examination, the equipment must be disinfected. Corrosive disinfectants are not allowed. Disinfectant sprays should be used carefully. If the spray disinfector is needed in the room, the equipment must be shut down, cooled, and covered with plastic film before starting the spray disinfection. Then, the equipment itself is disinfected by wiping the surface. Floor disinfection. Visible pollutants should firstly be removed, and then the floor should be disinfected. Furthermore, any other objects should be disinfected. Disinfection. Air disinfection for equipment room is recommended by using ultraviolet air radiation followed by ventilation for more than 30 minutes. The disinfecting or disposable protective products must be non-reusable. The reusable protective products should be placed and be soaked in 1000 mg per liter disinfectant or 75% ethanol for more than 1 hour. The fifth part, treatment measures of medical waste in radiology department. Collection process of medical waste. All waste from confirmed patients are regarded as infectious medical waste and should be managed strictly according to the following process. Process of disposing infectious waste is as follows. Put the infectious waste into the medical waste collection bag. Spray the bag with disinfectant containing chlorine. Seal the inner layer and outer layer and spray the layers with disinfectant containing chlorine. Paste special identifications in the outer layer and store it in the specialized site. Personnel protection. The cleaners should take the secondary level of protection and be responsible for handover registration, safe transportation, and proper storage of the infectious medical waste. The sixth part, summary and outlook. Radiological examination, especially chest CT, plays an irreplaceable role in the diagnosis of patients with COVID-19. Radiologists, radiological technologists, and nurses must have a great command of the individual protection and disinfection procedures when working in radiology department, especially in key areas. Finally, I wish this forum a full success. Thank you for your attention.
Thank you very much, Professor GAO Jianbo.